Welcome to another deep dive. We're going to unpack some research about canine epilepsy across the globe.
Yeah, very interesting stuff, focusing on the differences in epilepsy between dogs seen in general practice versus
those referred to specialists, right?
Exactly.
Okay, so before we jump into that, let's remind everyone, what exactly IES epilepsy in dogs? Like, how would you explain it to someone who's maybe never even heard of it?
Epilepsy is a disease that causes recurrent seizures in dogs, and seizures are these events that are sudden, short,
Transient,
and they can look really different depending on the type of seizure that the dog's having. But
because I think people think, oh, seizure, the dog's going to be like convulsing on the ground.
Yeah, that's one type.
That's only one type, right?
Right.
All
okay.
right.
So then we also classify epilepsy into different types based on its cause.
Right.
So the most common type is idiopathic epilepsy, or IE, and that's when we don't have a structural explanation for the seizures.
Like we can't find anything on an MRI, for example.
Right. Exactly. Okay.
And then structural epilepsy is epilepsy that IS due to something we can see in the brain, like a tumor or a scar from an old injury, or
even something like a developmental malformation.
Exactly, yeah.
Oh, wow.
And then the last type is called epilepsy of unknown cause, or EUC, and that's the diagnosis we give when we can't pinpoint a specific cause.
Even with like all the tests, you still can't.
Despite doing a bunch of diagnostic tests, yeah.
So interesting. Okay, and it's important to note, right, that not all seizures are due to epilepsy.
That's right.
Like, there are other things.
There are a lot of other reasons why a dog might have a seizure.
Yeah.
So,
like what?
Like metabolic problems, toxins, things like that.
Okay, and then just to touch on it briefly, the IVETF, the International Veterinary Epilepsy Task Force.
Yes.
They have this tiered system to help diagnose
idiopathic epilepsy.
Idiopathic epilepsy. Yeah. So can you just really quickly touch on that?
Yeah, so they have a tiered system, tiers 1, 2, and 3.
And the higher the tier. Yeah, the higher the tier, the more confident we are in that diagnosis of IE.
Okay.
But reaching those higher tiers often involve advanced testing, which is not always available.
Especially in primary care.
Right.
Which brings us to this research.
Yes.
So it looked at primary care versus referral populations.
Right.
Can we just quickly, again, just remind everyone what those are?
Yeah, so primary care refers to your general vet practice, like where most dog owners take their pet for routine care.
Right, their vaccines and stuff.
Exactly.
Right.
And then referral populations are dogs who have been referred to a specialist, often a neurologist, for
more advanced diagnostics.
Diagnostics and treatment, yeah.
Okay.
It's important to recognize that those referral populations are not really representative of all dogs with epilepsy.
Oh, interesting. Okay.
Yeah, because those are usually the more complicated cases.
Right, so it's kind of skewing the results if you're only looking at those.
Exactly.
Okay, so that's why they wanted to look at primary care, because it gives us a better idea of
just how common it is in the general dog population.
Yeah, okay. And then the other two terms that I think people get mixed up are prevalence and incidence.
Yes.
So can you differentiate those for us?
Sure. So prevalence refers to the total number of cases of epilepsy at a certain point in time.
Okay.
So like how many dogs have epilepsy at this exact moment.
Okay.
And incidence is the number of new W cases of epilepsy that develop over a period of time.
Okay.
So it tells us about the rate at which those new cases are appearing.
So prevalence is like a snapshot in time, and then incidence is over time.
Exactly, yeah. And most research does tend to focus on prevalence, but incidence is actually more useful for understanding risk factors.
Okay, yeah, that makes sense.
Yeah.
So let's look at the actual research.
Okay.
It highlighted some geographical differences.
Yeah.
In epilepsy prevalence, and they had some interesting findings from the UK primary care studies.
Right.
Can you walk us through those?
Yeah, so these UK studies use this database called Vet Compass, which is an awesome resource.
I love Vet Compass.
Yeah, it's great.
Yeah.
So they found that the 2-year prevalence of epilepsy of unknown origin, EUO, was 0.62%.
Okay, and just to clarify, when we say of unknown origin, we mean that they've done all the tests and they still don't know.
Correct.
Okay, so 0.62%.
Yeah, so for every 100 dogs seen in primary care over those 2 years, less than one would be diagnosed with EUO.
Okay, so not an insignificant number, but also not as high as some people might expect.
Exactly, yeah.
Okay.
And then when they looked at a 1-year period, they found that 0.82% of dogs had at least one seizure recorded in their medical history.
Okay.
And interestingly, the 1-year incidence risk was also 0.62%.
So mirroring that.
Mirroring the two-year prevalence here.
Prevalence. Okay, so roughly then, out of every 100 dogs that go into a primary care practice, in the UK, in 1 year, one dog's either going to have a history of seizures or have a new seizure.
Right.
Okay, now how does that compare to what we see in those referral populations?
So, as you might expect, the prevalence tends to be higher in referral populations. So one study in Germany found a prevalence of 2.6% in their referral population over 6 years.
6 years, okay.
A Japanese study found 1.9% over 10 years.
10 years, okay. And do we have any for the U.S.?
Yeah, so a study that was focused on idiopathic epilepsy in the U.S. found a prevalence of 1.04% over 15 years.
15 years. Okay, so it's all kind of over the place.
Yeah.
But generally higher in...
Higher in the referral populations.
Referral populations, okay.
Yeah, which makes sense.
And were there any studies that looked at both primary care and referral dogs together?
Yeah, there was one in Sweden that analyzed data from insured dogs, which included both primary care and referral.
Okay.
And their 11-year prevalence was 0.75%.
Okay, so more in line with that primary care data.
Right.
Okay, so it seems like including those referral populations can really make us think that epilepsy is way more common.
Yeah, it can really
and it actually is
inflate the numbers,
in the general dog population.
Yeah.
Okay.
Yeah.
So we've got a good handle on the prevalence and incidence.
Yeah.
But what about the actual diagnosis?
Sure.
The article mentioned some diagnostic challenges, so what were some of the main takeaways there?
Yeah, so one thing that they found was that there's a lack of consistent adherence to the IVETF tiers.
Especially in primary care.
Especially in primary care, yeah.
Which makes sense. I mean, it can be hard to do all those tests in a general practice.
Yeah, and it's not necessarily a reflection of the quality of care that's provided.
Right, yeah.
It's more just about the practical constraints of primary care.
Okay.
But it does raise some concerns about maybe the accuracy of some diagnoses.
Yeah. Are there any statistics that highlight that?
Yeah, so one study found that only 10.4% of dogs with new onset seizures in primary care were both diagnosed with epilepsy. And D met the IVETF criteria when they looked back at the cases.
Oh, wow. That's a
big gap.
Yeah. So only 1 in 10 dogs that are being diagnosed with epilepsy in primary care actually meet the stricter criteria.
Yeah.
That's pretty shocking.
Yeah.
So it highlights the need for more education and support for those vets in primary care.
Definitely.
Okay, so that's kind of diagnosis.
Yeah.
What about, I guess we'll get into management in the next part.
Sounds good.
So we were talking about how there's this big gap between epilepsy diagnoses in primary care and the stricter IVETF criteria.
Right, and that kind of leads into the next point about socioeconomic factors.
Okay, yeah. The research did highlight pet insurance as a big one.
Exactly, yeah. So dogs with pet insurance are more likely to get those advanced diagnostics and treatments, like
the higher tier evaluations that we were talking about.
Yes, exactly.
Because those can be expensive, especially things like MRIs.
Right, and it makes a difference. Like insured dogs are 1.5 times more likely to get that tier I or a higher evaluation.
Wow, okay, so finances really can be a barrier to getting a proper diagnosis.
Yeah, for sure. So it's really important to talk about that with owners.
Yeah.
Like, you know, what are their options? Can they afford the testing?
And maybe pet insurance could help with that.
Yeah, it could make a big difference.
Okay, so we've got finances, but then there's also this whole cultural aspect to managing epilepsy.
Yeah, that's an interesting part of it.
Yeah, can you talk about how different cultures view epilepsy in dogs?
So things like views on euthanasia, what breeds are popular, even how they see the dog's purpose.
Like working dog versus companion animal.
Exactly. All those things play a role.
Okay. Any specific examples?
So in Japan, they love small breeds, and euthanasia isn't as common.
Okay.
And epileptic dogs there live a median of 13 years.
Wow, that's a lot longer than...
Yeah, it's much longer than in some other places like Denmark, where it's more like 7.6 to 7 years.
So their cultural norms around end-of-life decisions really affect the dog's lifespan.
Right. It's a big factor.
And it's not just about euthanasia.
Yeah, it's also about how they view the dog's role. Like in Sweden, they found that working breeds...
Like herding dogs.
Yeah, herding dogs, hunting dogs, they tend to be euthanized sooner if epilepsy affects their work.
I guess that makes sense practically.
Yeah, it's practical, but it's complicated ethically.
Right.
And then companion dogs get more treatment and live longer.
Because they're seen as family.
Right, so people are more willing to spend money on their care.
Which is where those socioeconomic factors come back in.
Exactly, it's all connected.
Yeah.
And then speaking of different locations, there are also regional differences in access to care.
Oh, right. The Swedish study talked about that.
Yeah, they found that dogs in the north, which is more rural.
Yeah, less vet clinics.
Right. They had a 22% higher risk of death.
Wow, just because of where they lived.
Yeah, it's a big disparity.
Okay, so that brings up the issue of equity in vet care.
Yeah, making sure all dogs have access to specialists no matter where they are.
Definitely. And beyond just access, we have to be sensitive to those cultural differences too.
Absolutely. It's not one size fits all.
We need to be respectful of everyone's beliefs and tailor our advice accordingly.
Exactly.
Wow, this is really complex.
It is, but it's fascinating how everything's connected.
Yeah, human behavior, our choices, the systems we create, it all affects our dog.
It all has a ripple effect.
Okay, so we've covered diagnostics, socioeconomic factors, cultural influences, and even regional differences.
Yeah, it's a lot to take in.
But before we wrap up, let's try to pull out some key takeaways for everyone listening.
Okay, sounds good.
Okay, so we've learned a lot about epilepsy in dogs from all over the world.
Yeah, it's been quite the deep dive.
So as we wrap up, what are some things you want listeners to really think about?
I think the main thing that comes out of all this research is that we need to understand epilepsy in dogs a lot better, especially
in primary care.
Yeah, like those general vet practices.
I remember most dogs are actually seen.
Exactly. So we need more research focused on that to get a more accurate idea of
like how common it really is.
Exactly, like the true prevalence and incidence worldwide.
So it's kind of like bridging that gap.
Yeah, between what we know from those complicated cases that go to specialists.
And what's actually happening out in the real world.
Right. And to do that, we need better education for vets.
Oh, yeah. Definitely.
And more awareness among dog owners.
So that they can ask the right questions.
Exactly. Vets need to be able to diagnose and manage epilepsy, even if
they don't have, like, an MRI machine.
Right. And owners need to understand the signs.
And how complicated it can be to actually diagnose.
Yeah, so that they can advocate for their dog.
It's like a team effort, really.
It is, yeah. Everyone working together.
And part of that team effort is being honest about money.
Yeah, financial constraints are a real thing.
Pet insurance can help, but
it's not a solution for everyone, but it's something to consider.
Definitely.
So that cost doesn't become a barrier to good care.
Okay, and we talked about those regional differences.
Yeah, how hard it is to get to a specialist.
Especially in rural areas.
Right, and that's a huge issue for equity in vet care.
So we have to figure out how to make sure all dogs,
regardless of where they live,
can get the care they need.
Exactly.
And then, of course, we can't forget about culture.
Yeah, how people view epilepsy really affects everything.
Diagnosis, management, even how long a dog lives.
Right, so we need to be really sensitive to those differences.
And remember, there's no one right answer.
No, it's all about respecting different viewpoints.
And tailoring our advice to each individual situation.
Exactly.
So it's amazing how all this ties together.
It is, yeah.
What we do as humans, the choices we make.
It all affects our dogs.
The systems we create, our cultural values.
It all has an impact.
So by understanding epilepsy better, we're not just helping dogs.
We're also learning more about this really complex condition.
In general, yeah.
It's all connected.
Well, this has been a fascinating deep dive. Thank you so much for sharing your expertise.
You're welcome. It's been a pleasure.
From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.